Okay, well, welcome. I'm very excited to be talking with Dayna Gurley, one of our alums from the Graduate College of Social Work today. And Dayna, why don't I have you introduce yourself and tell us a little bit about when you graduated and what your job is prior to the COVID-19 pandemic, and what your job looked like on a day-to-day basis.
I'm Dayna Gurley. I am an emergency room social worker at one of the Trauma One hospitals in Houston. And as an emergency room social worker, I I think it's one of the purest jobs in the hospital for social work because I have to kind of know everything. I help with all traumas and crises that come in, not just maybe have to identify patients and figure out who they are, but then also kind of deal with the family dynamics that come in, educate the family, work on safe discharge planning, domestic violence, APS, CPS. That's kind of many of the things that I did before COVID-19.
Great, that's a lot. That's a big job to begin with.
Yeah.
So what's your job like now? How's your routine changed, and what are you working on now?
So I think that my scope of work has not necessarily changed, but how I practice has changed. First of all, in the emergency room, we have to wear masks at all times, but all the hospital now is wearing masks at all times, but we've been doing that for a few weeks now. Any isolation rooms, if I have to go into any isolation rooms, I have to put gowns on, gloves. I have to just wear a lot more armor whenever I go in to help people than what I did before, especially if they're isolation rooms.
Right.
And then also, I have had to do several instances where I've had to kind of manage in the hospital system. We're now kind of restricting some visitation. Some families don't always like that. And so it's my job to go and educate them on the policy and to kind of manage some expectations and to kind of de-escalate situations.
Right. So a lot of the day-to-day is the same with the additional layer of the protection, and then some of these more situations like having to tell families why they can't visit that just weren't an issue before.
Right.
And it sounds like, so you mentioned that you've been wearing masks for a few weeks. Are you and the other social work staff, are you feeling that you're getting the protections you need to prevent exposure to the virus? We've heard some stories of social workers not having as much access to masks as maybe some of the doctors or nurses. What's it like where you are?
Yeah. So in the I think on the floors, the floor social workers, they may, I don't know what necessarily they were experiencing in the emergency room because I'm embedded with the staff there. I've always had a mask. I think that I think now that's like I said, they pass them out at the hospital because no visitors are allowed. And so everybody has that now. I think for me, I do have occasionally had to go into isolation rooms, which I do not think that the social work staff on the floor have necessarily had to. They can make phone calls in the emergency room. I've had to, if a patient has come in, they may have come in for a fall and hurt themselves, and in that process and in the assessment after the trauma, and everybody kind of they start doing the assessment, they realize that this person could possibly be a person under investigation that they may want to test because they fit certain criteria, maybe shortness of breath, and it may not end up being that, but I occasionally do have to go into rooms where we aren't real sure. And I also think in the emergency room, we don't ever know. And I don't ever know because we don't have real-time testing. So even the people that I do see, I might not ever not know if they tested positive. So, yeah.
Are you seeing people coming into the emergency room, though, with what is believed to be COVID-19 symptoms, even though you can't verify it on the spot?
So I think anybody that comes in and we have a questionnaire that has to be answered. If you've traveled, if you have a cough that you've recently started coughing, or if you have been running a fever, whatever, we have a questionnaire that has to be filled out. And if that is in any indication, if you indicate any of those things, then they look at you closer. The hospital that I work at, they're really good about if that's even an indication and you're a walk into the emergency room, all that is generally, it's a separate triage, it's a separate area for them to go to. Even if you come in and they test you because you've checked yes to a recent fever, you will go to a different area even. So our hospital's really prepared for that. I think out of necessity, they became really quickly to get prepared for that. So I don't, it's the ones that come in under a trauma that I may go into the room and just not realize until later that they might need to get tested or something.
Right. Okay.
Yeah.
I think, one of the things that we've talked about a lot among social workers is that when you have crises like these, and I think we saw it with Hurricane Harvey a few years ago, they tend to shine a light on some of the bigger inequities that we face in society. How have you seen that with the people that you've been working with?
Well, I think that homelessness is one of those, I think it encompasses so much too, because there's mentally ill, there's substance use, there's just areas of poverty. And when you look, I don't know how prepared that people were to address at the very beginning necessarily. I know that steps have been in place now, but to address what do you do with a homeless person if there's a possibility that they need to quarantine, or if they test positive and we need to isolate them, what do you do? I don't think at the beginning there were answers to that question, although, our hospital stepped up to that, but, and had a solution. I think now they're starting to figure that out, but that's a population that just wasn't even considered at the beginning of, for the first few weeks, I would say.
Really? Okay. Yeah. So you said that the hospital has a plan or a protocol now. What does that look like?
Well, if from my standpoint, if somebody comes in and there's not a safe discharge plan, and if there has to be any kind of a test or then, and they can't go and isolate or quarantine, or if they may be vulnerable even, and they come into the emergency room and they're vulnerable, but the only option is to send them to a shelter, which could have the virus in it, what is my job? And my job then becomes to advocate for the patient to stay in the hospital, maybe in some other area, because they cannot quarantine properly or isolate properly. So that's my job as a social worker, is to advocate for those people.
Is there space?
Pardon me?
Is there space for them? Has that happened? And is there space?
There's preparations going on within the hospital system, within the hospital district, to make space for the possibilities of what they're predicting to happen in this area. I think now I've heard that the health department has now gotten involved. So then there's going to be a place for people who don't need an acute hospital setting to go to. That's being worked on.
Wow, interesting. I think the other thing, in addition to kind of shedding a light on these inequities, I've been thinking a lot about how we can look for opportunities in a crisis like this. And are there ways that we can think differently? Like the homeless population is a great example. Are there ways we can think differently about how we treat the homeless population? I keep thinking of this idea, like, can a crisis like this expand our moral imagination for how we treat each other moving forward, how we address complex challenges in our society? I just read earlier today that the city is leasing hotel rooms for some people who are homeless so that they have a place to be and they have a place to self-isolate. What would a world look like if we did that when there's not a pandemic?
Agreed.
What are some of the things that you've been thinking about as it relates to that? How could we, once this is hopefully over and we have some kind of sense of normalcy, how might we think differently about the way we address some of these bigger inequities?
I was thinking earlier today, one of the things that's really interesting about this time is that we're going to have all of these examples of the inequities that are in the world today through this pandemic, and figuring out a way that we as social workers can bring these examples to the forefront in a fact-based, non-judgmental way, to where people don't always react to some of the solutions on the defensive, or blaming the victims for what's going on. And I think that now's the time that we could really start identifying how we could help the homeless and bring these examples forward and do it in a very logical, fact-based way, so that there's a lot less argument. Because I think there's some push and pull. Well, everybody needs to stand on their own 2 feet and go get a job. And that's not always logical. And I think that now's our time that we as social workers could be very creative in how we present these problems and the solutions to the problems. I think also another thing that we could start doing, and even now while we're experiencing this, is start looking at planning for the recovery process from this, because there will be a recovery process. So while I am extremely grateful that I have a job right now and that I have income that's still coming in, there are a lot of people who could not afford to be without an income coming in that are going to need supports, and us thinking about those ahead of time, so that this sort of thing doesn't happen again. And preparing, thinking about testing, what's the root cause, identifying the solution for the root cause, and then if we had been testing all along, we could have maybe isolated people who were testing positive, and the people that weren't maybe would have had an opportunity to continue working. I mean, but thinking about those things moving forward, I think would be really, really important for us.
Yeah. So really, it sounds like you're talking about really thinking about some of these bigger macro structural issues that create like conditions that lead to homelessness in the first place, and seeing what we might be able to do. I think it's interesting, just 4 or 5, 6 months ago, I remember people just hearing about the concept of a universal basic income that Andrew Yang had talked about. And a lot of people just thought that was crazy, ridiculous. And now that's something that's really in the public consciousness, like might actually be necessary.
Right. Well, and think about even housing the homeless, that the thought to some people of housing the homeless and the money and the expense that goes into that, when you factor in all of the other expenses that happen because of that, the jails, the health care, the theft, the crime, all of those things that factor in when you have a high homeless population, or when you have a lot of poverty. Housing the homeless person seems like a small amount of money comparatively, and having people be able to look at those things in a different way. I think we're in a time that might be something that could happen.
Yeah, absolutely. So it's like, what if we took all of the money that we spend responding to people who are homelessness and all of the things that result from that, and used it to try to prevent it in the first place?
Beautifully said. Yeah.
Yeah, I hope we start to have those conversations. I really do. So lastly, what are ways that we as a social work community can help you and other social workers and the clients that you're working with?
So I think as a community, staying educated, looking out for your neighbor, thinking, because there's so many elderly people that need assistance right now, or that are going out and still going to the grocery store. How can we assist people? I think that's a big way that we can help us. And as social workers, we're natural givers like that. But then also thinking selflessly, and then maybe that's part of it, versus selfishly, not hoarding, not exposing ourselves unnecessarily in this time of social distancing. I think you just heard in Florida where they were still having spring break and everything like that. That's thinking selflessly, and realizing that you might not be worried about the virus hitting you because you may be strong and healthy, which that doesn't always mean anything, but how you could be passing that on to somebody else is important. But I think from the social work community, I think it kind of goes back to what we just talked about, preparing for that recovery, because it's coming, and how do we start thinking about addressing those when life starts to gradually return to normal. And then practicing self-care, and making sure that, because this is an unsure time for all of us, and having those connections of people that we can talk to, that we can call and say, hey, how are you doing today? I know I call several of my social work friends within the hospital system almost daily, like, how are you feeling? Just to make them feel better, to know that there's somebody else there, and then to be able to just assist the people around you. Especially in the medical community, in the emergency room, if we start seeing anxiety, to be able to talk to them, to the nursing staff or to the doctors, and just being able to have those conversations. I think in the emergency room, we're pretty good because we handle some pretty heavy stuff on a regular basis, but just being able to communicate.
Yeah, those are great ideas. I love the first idea that you said, just reaching out to your neighbor, helping your neighbor.
Yeah,
that's awesome. Yeah. Hey, Dawn. Well, thank you so much for taking the time. I know you're super busy. So I really appreciate you doing this. I think this is beneficial to some of our students moving forward. So thank you very much for being with me tonight.
Thank you.